Okay, hi everyone. Can you hear me? Okay. If not, use the chat or unmute yourselves. So it looks like we are not that many people today, but it's fine. We can make it more interactive. I'm also sorry that Till doesn't seem to be joining us, but maybe one of the next times before Christmas. Yeah, and we also don't have a lot of new content to cover. I was thinking that it might make sense to spend more time on talking about what we have introduced the last seminar and talk about each of your progress rather than diving into the risk of bias assessment and meta-analysis, because it's kind of still a few or a couple of steps ahead of the current stage. So yeah, I think it makes sense to make sure that we are all on the same page, that we are all getting kind of our heads around the Prospera registration and using Ryan and the screening, and then we can slowly discuss quality assessment in next week's or in 2 weeks seminar. Okay, so I wanted to start with the questions that some of you have sent to me. If I'm not quite sure, because I received some via WhatsApp and some via email, so I might have missed some. If this is the case, you can let me know afterwards. So the first question was asking how to deal with systematic reviews, which are dealing with an aspect of our topic. For example, if they look at treatment costs, do we include them or do we look at the reference list? So first of all, it is possible, if there were several systematic reviews on your topic already published, you would probably have chosen another topic because we advised against doing this. But generally speaking, it's possible to do a systematic review on systematic reviews, which is also called a mega review or a mega analysis. But this is not what we are doing here. We are doing a systematic review on primary studies, which means that we are not including systematic reviews. They would be non-eligible, but they are very important for us as a source of information. So if we find a systematic review that somehow is related to our topic, I would always suggest that you go through the list of included studies or the reference list of the systematic review and see whether there are any more additional studies coming up that you haven't yet identified and that seem to be eligible for your research question. So in a sense, a systematic review can even be a good double check. If this systematic review is related and doesn't show up any of the studies that you have already identified, it might be a bit of a problem with regards to your search string. It might be a hint that the search string might be incomplete or something. But if many of the studies are overlapping, it's a good sign. Does that make sense? Does this answer the question? I don't know who of you was, I don't remember who of you was asking it, but if not, just scream or type. Okay. So I'm moving on to the next question. This was about cost effectiveness studies in which a new treatment or like a drug is compared to an old one for the disease of interest. And then the question was whether we would include them or whether they are not relevant enough. So this one is tricky. It's a good question. I would say that it's not exactly the question that we are looking at, because we are looking at the costs that are caused by a disease rather than the costs that are saved by a certain treatment or drug. So generally, I would say these studies are not eligible, but I would still look through them carefully to see whether they include any relevant information on the actual costs of your disease. So it could be, for example, that these studies have like a first part where they provide some average statistical information on the direct costs of a certain disease, let's say breast cancer, And then they compare 2 different treatments and evaluate which one is more cost effective. So it could well be that these studies mention the overall cost, like direct cost or also indirect cost of our disease. So I would look through them, but in terms of the design, it's probably not eligible. But I think this is tricky and needs to be assessed on a one-by-one basis. So I wouldn't exclude these studies at the screening stage now. I would look through the full text and then decide. Okay, I hope that also makes sense. Interrupt me anytime if you have questions. Then the next question was whether there's a way to delete duplicates in Ryan. We will look through Ryan together after I went through these questions, and I will share the screen, and Marie has provided me with her login details, so we can use her identified studies as an example and go through it together and also talk through some Ryan features. For this question in general, I don't think, but I'm not a Ryan expert, but I don't think they have this feature to delete duplicates. But what Ryan is doing is that it recognizes hits that are identical as duplicates, which means that if you are shown, either it groups them right away and you will see them appear like line after line, or if it doesn't, even if you click on exclude or include for one of your hits, if they are duplicates, Ryan will do the same rating for all other hits that are identical. So at least we would be worried about duplicates if there are, let's say, 5,000 duplicates, and you are forced to screen them like 5,000 times. But in a sense, Ryan makes sure that then you would only screen 2,500, and it uses the same decision for the duplicates. And I think there are also in some reference programs like EndNote, there's also an option to remove duplicates or to deduplicate your reference list, which you should do before you import it into Ryan, or you can do that. You don't have to, but if you want to remove the duplicates straight away, you could use your reference system, depending on which one you have, to get an indication of how many duplicates you had. Then deduplicate, which means that you delete all the identical records and only keep one of them. And then you import it in Ryan. It wouldn't show you any more duplicates, and you could just continue with your screening there. But I think either of the options is fine. The important is just that you somewhere note the number of duplicates that you will remove for your Prisma flowchart. And both reference programs make sure that you don't double screen records that are identical. Okay, any questions with regards to that? No. So the next question was how we can highlight exclusion criteria in Ryan, or I think more specifically, the question was whether we can create new categories for reasons of exclusion. Like, for example, we find a study and it's in Chinese, then we could create a new tag or label which says different language and assign it to the study. So this is possible. I can show you how this is done later. But in general, I think given that most of you will have quite a large number of hits, between 10,000 and 20,000, I would not justify the exclusion of each and every record, because you will exclude most of them. It already takes a lot of time to go through them, to just click on exclude, and clicking on the reason for exclusion will take more time, and you don't need to report that information necessarily. So I would actually not bother with doing that. Maybe only for the studies you are unsure about, you can add additional tags and comments. But for those that you exclude for sure, I wouldn't provide any reason. I would just click exclude. Okay. And we will again look at this together in Ryan when I share the screen. Then a question was whether there's a way to see both title and abstract in Ryan. So whenever I have worked with the software, I've almost always seen both title and abstract, because usually these are linked to each other with most reference systems. So only in very rare cases when a journal does require an abstract or something, this wouldn't appear on the screen, but usually it does, and it should for like 99% of your records. So is any one of you experiencing this problem that you can only see the title and not the abstract, or does it work for all of you? Anyone here who is struggling with that? Looks like no. I think if you want to speak, you need to unmute yourself. But yeah, then I'm just assuming that all of you are fine with regards to that. Okay, now I'm confused. Where are my slides? There. Okay. Yeah, so this should be fine. These were the questions that I had on my list. Is there any other question that one of you had that you would like to ask now related to anything like the Prospera registration or Ryan or database searches? Okay, it looks like you're all fine. Then what I thought we could be doing today together is going through a sort of case study using one of the systematic reviews that are currently being conducted and looking through the inclusion criteria together and discussing whether we think they are complete or whether we would define them differently. And yeah, I will just show them on these two slides and we can go through it one by one. Just to give you context on the review topic, it's a systematic review on the economic burden of child abuse and maltreatment and neglect. So here we first define the inclusion criteria. So you can all look through it, start looking through the types of studies, participants, and type of outcome measures, and comment on whether you think these are adequate or whether you think there are some problems, whether you would change something. Any comments or concerns?
I would say the publication date until 2019 would include every publication that ever existed, right?
Mm-hmm. Yeah.
I think depending on the results, this is something we wouldn't want.
Yeah, that's a good point. So we were discussing this in the last seminar, that if you get too many hits, you should start constraining your number of hits by, for example, constraining the results to the past 10 years or the past 20 years. So in that case, this would be more important information than the ending date, because it's quite clear that all systematic reviews will only be conducted up to the date of now. But then it would be important to specify here if it was, for example, from 2000 to 2019. But for some of you, you don't put any date requirements or constraints. So for some of you, this might be fine, but those who put this additional constraint, you need to specify in your protocol. Exactly. Any other comments? So what, for example, do you think about the population specification? And first, I also didn't question this, but specifically thinking of indirect costs, what could be a problem here?
I mean, what was the problem about the types of participant? I think, since it's my inclusion criteria, what I should have written different is that what I meant by saying is that I meant children maltreated until the age of 18 years, but the indirect cost could happen later, like, for example, due to work, I don't know, decreased workforce or less education or whatsoever. But I didn't really know how to write that with the types of participant, because actually the maltreatment should happen before 18 years. But like what I'm also including or trying to include is the consequences after 18 years.
Exactly, yeah. So this is a bit of a tricky case, and it won't apply equally to other research questions. The specificity of this disease or kind of medical phenomenon is that exposure in this case happens at ages 0 to 18 by definition, but then there are a whole number of long-term consequences that could matter much later in life. Like, for example, thinking of someone who was abused as a child and then in their 30s and 40s suffers from depression in result of that. And of course, it's always difficult to say that something is causally in result of something happening in childhood, but it's very possible. And then imagine this person wouldn't be able to work for some weeks or months because of depression. Then this would be an indirect cost of child abuse. So in this specific case, I would define the population as children and adults, and then as the intervention, if we think of our PICO question, for the intervention, I would specify that we only look at experiences of physical, emotional, sexual abuse and neglect that happened between at the time when the person was 0 to 18, if that makes sense. And then for your specific case, it would also be important that the primary study that you wouldn't include a study that looks at the economic burden of depression, because then you wouldn't know whether it's due to child abuse or anything completely different. So all of the included primary studies should directly make links to child abuse with any other kind of consequence that they are assessing in terms of indirect costs. Does that make sense?
Yes, but when you later on look at Ryan, I thought it was kind of complicated to really see which ones to include or exclude, because it's so sometimes specific. For example, like one study is only about transgender children in China and they had maltreatment and therefore later on depression or something like that. And then it's like, yeah, in parts it's true, but I'm rather interested in the bigger group. So I didn't really know, like I excluded this one, I think, but I thought it's hard to tell because they are part of the population, but it's kind of too specific, I thought.
Yeah, that's a good point. And I think that would matter for all diseases. That in general, you might find very specific studies with only a very specific subsample of a population or subgroup of a population. And even if you think about it, patients are already not representative for the wider population. They are already a sort of subgroup. So in general, I think we can include subgroups, but we would need to make a note of that in our table of inclusion criteria. We would need to specify in the very beginning whether, like, who the population of the specific study was. And then later in your review, you can discuss questions of how representative certain reviews might be. And then, for example, when it comes to meta-analysis, we would never combine evidence from, let's say, a subpopulation of transgender children in China with children between 0 and 15 years or something, because there would be too much of a difference between these groups. But this is something that we can then kind of decide on a one by one basis once we know what our list of included studies looks like. For now, I would be over-inclusive. I think for your specific case, with transgender children in China, it's also fine if you have excluded it. But in general, for now, I would include subpopulations and then later deal with that in a sense. So looking at the third row, the types of outcome measures, what do the others think about these? Any comments?
Nina, can you hear me?
Yes, yes.
Finally. So here I see that systematic review, meta-analysis, and literature review are included as inclusion criteria. Since they are not primary studies, can we include it in the inclusion criteria?
Yeah, that's a good point. So this is the row with types of studies. We would, at the first stage, we would probably still include systematic reviews and meta-analyses, but then only look through the reference list. So in the end, they wouldn't be eligible studies. We would not ignore them. We would look through the reference list and through their included studies, but we wouldn't list them as primary studies in our list.
Okay, thank you.
Yeah, so that was, yeah, well spotted. So with regards to the outcome measures, what do you think about the first point, the prevalence of child maltreatment?
So I think it feels kind of necessary to include it.
Mm-hmm.
However, I don't really know what the consequence of it is.
Yeah. Yeah, good point. So I think if all of you included prevalence studies, the review would become huge. I think you are right to like a primary costing study, or if we really wanted to establish the economic burden of a certain disease, we would want to know the prevalence of the condition in any country, ideally, and then the cost of these diseases in any country, and then kind of calculate an average global cost estimate. But for these systematic reviews, I think this goes too far. If we also include prevalence as an outcome, it will explode. You will just have like maybe 100 included studies or more. So yeah, I wouldn't include prevalence studies. I would hope that most cost of illness studies that you include would mention prevalence, because in order to assess the economic burden of a disease, you kind of need to factor in how many people suffer from a certain disease. So I would assume that this information is somewhat included in the studies that are eligible, but a study that only looks at the prevalence of a disease, but not at any associated costs, you would exclude. Does that make sense? Does everybody agree? Okay. If not, interrupt me at any time. But yeah, I think if we wanted to include prevalence studies, also thinking of our search string, we didn't include prevalence or incidence as like search terms. So we didn't specifically look for prevalence studies, which means that they are not supposed to be included if they don't include any cost estimates.
I have one more question to the types of participant. In that case, would I write like children and adults up to 65 years, for example, because after 65 years they are probably not working anymore, and therefore the relevance is not that high.
I think that would be a decent.
Okay.
Yeah.
Okay. Thanks.
Cool. Okay, so this was with regards to the inclusion criteria. Now we look at the exclusion criteria. They are quite related, but anyone has any comments on these? So maybe to comment on the first point, that we exclude publications after 2019. This is kind of assumed, and this is why you indicate a starting date for your systematic review. So nobody will expect you to kind of, that's why you indicate the dates of your searches, and then nobody will expect you to have included a study that was published after your search date. However, what is often being done is if people register protocols like 5 years earlier than when they actually conduct the systematic review, then reviewers would say, this is outdated, your search was conducted 5 years ago, you need to update. Or as we discussed in our first seminar with Professor Bernighausen, some journals like the Cochrane Collaboration Library, they would require you to commit to updating your review after a certain time. But for you are all working on the timeline of, let's say, around 1 year. This wouldn't be a problem, and this is something that you don't have to worry about, because everybody faces the same problem with systematic reviews, and they tend to get, especially when you are working on a very topical issue, they tend to get outdated quite quickly, but it's not your fault. So that is fine, and you don't have to specifically state that. With regards to non-English language, some of you have specified that you would also include studies in German. I think in general, all of your search terms were set up in English. So usually you would only identify English references either way. But sometimes journals require English and a specific language abstract. So you might also kind of identify studies that are only full text published in Spanish or English or Spanish or German or any other language. You can either exclude them right away and only do English language publications, or you extract information on any other language that you speak and that does not make a big difference to you and that you identify through your English search term. But it's not really relevant, because we can assume that there's some sort of bias already introduced by the fact that we only search in English. So we are not able, for example, Spanish only journal publications we would not capture with our search string. And this is like a very common bias in systematic reviews, and there are reviews on language biases in systematic reviews. And they do note that it is quite a problem and that it underrepresents evidence from low and middle income countries and countries that are not part of the global north. But it's a common bias almost inherent to any systematic review. So we don't have to worry about it. You just need to be aware of it. And it's also something that you can always discuss in your limitation section. So usually your papers will have in the last section, a discussion in which you quickly note all the limitations of your review. And there you can specify this might be biased, and low-income countries specifically might be underrepresented because we only searched in English language. Exactly. Then the next point, gray literature, it's also a good comment. And with our focus on these specific databases, we are not searching specific gray literature databases. So we might not find studies that are published, that are not published, but maybe part of a policy report or something. But again, yeah, we choose to be more pragmatic and not go through a whole lot of gray literature databases, and it's okay. But we need to be aware of the fact that it's possible that there is some evidence that might be relevant for our research question that we don't capture because it hasn't been published in a peer-reviewed journal. And then, yeah, types of participants is, in this case, we wouldn't exclude any, or we would exclude participants over the age of 65. And for types of outcome measures, yeah, it's important that you only think of economic outcomes for your systematic reviews, like any sort of health-related outcomes or mental health consequences of a certain disease or something. You don't look at here. They might be relevant for other reviews, but we only focus on outcomes that are related to direct or indirect costs. Okay, everybody agrees with that? Cool. I think in general, you might need to specify something similar for your Prospero protocols. Not necessarily in a table, but for the protocol and also for this screening stage, you need to be very clear about what your exclusion criteria and inclusion criteria are in order to make the judgments of which titles you include and exclude. So it's something that all of you should either already have spelled out or have in the kind of back of your minds while you are screening. For the Prospero protocols in general, some of you have already sent theirs to me, and you can also upload them in, I have created a new folder on Google Drive. If you want to compare yours with others, you can all upload your Prospero registrations. And in general, when drafting these, I recommend you to look at existing Prospero protocols, ideally of another economic burden systematic review, because those would be very similar. See how they have written it up and then try to mimic the way that they have written it up. And of course, never repeat word by word what they write. But that would be the most straightforward strategy, I think. And yeah, I've already received some good examples. So if you share these between yourselves, then that might also be very helpful. And then for the Prospero protocols, I would suggest that you also share these with Professor Bernighausen, and you might also want to wait for after the seminar that we have next, in which we discuss the quality criteria assessment in more detail, because one of the fields that you need to fill out for the protocol is how you will assess the study quality and do the critical appraisal. So for this, we can discuss different strategies for that. Then you can list these and then submit your protocols maybe right before Christmas, for example. But you can also submit them at a later stage. There's no real time pressure, but this is what I would suggest as a timeline. Okay, are there any more questions with regards to the Prospero registration? One question was in our WhatsApp group on how to remove this click about stating that the review has not yet started. If you can't remove the click, it might have to be a default set by Prospero. Then I would just, not worry about it. Then we state the review hasn't started. Because what they actually want to prevent is that you have written it up and you have selected all your inclusion criteria and all your outcome measures and everything after registering it, but we are not that far ahead in the process anyway. So I think it's, yeah, if it doesn't work to remove that click, then yeah, don't bother. Okay, then as the last step of today, I would go through Ryan as like sharing my screen at first. Okay, can you see my screen? Yeah, it should work. Can you see, no, you shouldn't be seeing the slides. Can you see my my browser with Ryan? No? Okay. Let me check. Screen. Yeah. Now? Yes, perfect. Okay. So this is the login window for Ryan. I don't know why it looks weird. My internet connection is fine. Yeah, sometimes Ryan is also down. I don't know whether you've already experienced this. Okay, but now it seems to be working. It's just very slow somehow. So this is where you see, okay, now we are back, sorry. This is where your own registered review will show up. There's also this option invite, which means this is where you could add a second reviewer if you decided to collaborate with one of the other PhD students and to co-screen or double screen some of the titles. You could invite that second reviewer here, enter their email address, and also select whether it will be blinded or unblinded. I would suggest to add blinded review, and then they can access your review, but they won't see your rating decisions, and you can do it completely independently of each other. So that would be the most high standard kind of approach. And I wouldn't, because you all have enough titles and abstracts to go through for your own review. So you don't want to double this by doing another review, but you can do something like a 10% subset rule. So you could screen 10,000 titles for your own review, but then only 1,000 for one of the other students' reviews, and could state this in the paper. It would already be considered as more rigorous in a sense as compared to doing all the screening just by yourself. But yeah, you can decide whether you want to collaborate and co-author or whether you would prefer doing it by yourselves. I think both options are fine. Then what you can also see here before you log in is how much of the search you have already completed. So for example, Marie still has 98.7% to do. Yeah, this will be a bit frustrating in the beginning to look at this, but it will get better. And here you can see how much time you already spend on it. Yeah. Then if you click show, this is how you can access your review. I'm sorry for Ryan being very slow. Yeah, and then this is where your titles should show up. And in this field, you would see the abstracts for each title. Then here on the left, you see the duplicates. So in general, you have around 4,600 something duplicates. And then the most important tab is this one. This shows you your ratings included or excluded, and those that you're unsure about, and then undecided are all those that you haven't gone through yet. And we can see here that Marie already went through these because her name appears next to the title. So now if we click on one, we can see the title, and here we can see the abstract. Now it shows us all these that are undecided, so without Marie's ratings. And one question was how we could add a label. So let's say this one, we would, for example, think maybe it should be included, and you could add a reason. Or a label, but yeah, here you could add a reason, either one of these that are listed. Like, for example, maybe you are not sure about whether this should be excluded or included because you think the outcomes might not be relevant. So you could add this, or you can also make up your own label. You could say maybe it's qualitative evidence, which then wouldn't be eligible, and assign this label. I will remove them, Marie, because otherwise this is all doesn't make sense. This is where we can remove the labels. Okay. Any questions about this? Yeah, in general, I would say don't use the labels for everything that you exclude, just because it takes too much time and it's information that you don't need to provide. You can use it as a note to yourself for your maybe articles. Like if you look at something and then you're not sure what you should be doing, you can put a comment, what you think, or why you are hesitant, and then you can see it attached to the article. If you are two reviewers, you will see both names for all the titles that you have both looked at. Okay, then what I would suggest is that we together look through some of Marie's maybe ratings. Now we know Marie's research question, we know her inclusion and exclusion criteria, so we can use this as a joint practice in a sense, and look through some of these titles and abstracts together and decide whether you would exclude or include. So I would suggest let's start with the first, like let's do the first three together. You can all, I will remove, I don't know how to get rid of this. You read through the abstract and then we decide together whether it should be included or excluded. And I put this here. Is it big enough for all of you? Okay. So whoever has a whoever has a first opinion on exclude or include, you can let us know. So who would include the study? No one? And why would you exclude it?
I mean, it doesn't really focus on the costs. It looks at a lot of effects of former child abuse, but yeah, as far as I understood it, it's not really focused on costs.
Yeah, I fully agree with you. This is why I would also exclude.
Well,
yeah.
I have just one question, because I also thought about excluding like a lot of studies, but the problem for me was like really actual fitting studies where, I mean, I didn't search so many papers yet, but were quite little, like focusing on the costs specifically.
Yeah.
And should I then, that's why I rather tended to be over inclusive or more often pressed, maybe because I was, somehow this is related to the topic.
Yeah.
But should I then rather exclude all that are not related to the cost? But I don't know, so far I didn't really get that many really proper hits, to be honest, where I really thought, okay, this is completely matching my criteria.
Yeah, no, it's a really good point, and I think that's why it's important that we do this exercise together. It is very, very likely that you will exclude the large majority of your studies. Like, I assume that more than 90% of the titles you will end up excluding. And this is why it might feel like you are doing something wrong in the beginning, because nothing really matches your criteria in the beginning. I mean, now you have went through roughly 200 studies and you have 6 included studies. This is already quite a lot, I would say. So yeah, don't feel worried or feel concerned if most studies seem completely irrelevant. It's expected, and we always do searches that are much more inclusive than specific. So we expect that most of this stuff will be completely irrelevant and unrelated. And probably for you, it was already, when you were doing this exercise, you were already kind of happy when you saw child abuse mentioned. And then you clicked maybe, or because some of the titles might not have even included the word abuse or child abuse.
That's exactly true.
Yeah, I totally, it makes a lot of sense. And I felt exactly the same when I conducted my first screening. So yeah, as a general comment to all of you, don't worry if most of the stuff is super irrelevant. It's expected. It doesn't mean that your search string is wrong. It doesn't mean that you are not catching the right things. It just means that you also need to be careful, because if you find, like, if you read through 200 titles and they are all irrelevant, then it might be easy to kind of go over the one that is relevant. But yeah, I mean, you have already identified 6 that you included, so it very much looks like you are doing everything correctly.
I've got one more question. I'm doing this alcohol theme. I've found some studies which focus on very small minorities, like I found one which is only on truck drivers. So the question is, just according to the Prisma, if it looks at costs or economic effects, I should include it. But I mean, in the end, I think there would be a strong bias if you have 20 studies and one is on truck drivers. So yeah, what's your idea about?
Yeah, it's very similar to Marie's point on the trans kids in China. I think at this stage I would include, because especially if you look at, let's say, for example, at truck drivers, they are probably men between 30 and 50. So they could be somewhat at least they could give an indication of the costs of a treatment, for example. So I would include them for now, especially for direct costs. We are not, like, in a sense, causally looking at risk factors for alcohol use or something. Then I would be much more worried even about the representativeness. But specifically for direct costs, it shouldn't matter who the subgroup is. The costs for treatment should be more or less the same for any person. Of course, then complications and severity and everything will play a role, but it would be relevant information for any population. And then also the general employment outcomes, how many days they miss, could also be somewhat relevant for other populations. So I think at this stage, I would include all subpopulations, as long as it's looking at direct or indirect costs. And then this is something that you need to comment on very critically in your risk of bias assessment and quality rating, and also in your discussion. So I definitely agree with both of you that we wouldn't use this as a representative study, and we would be concerned about this. But in a sense, you look at this problem at a later stage of your review.
Okay, thank you.
Cool. Any other questions with regards to your specific studies? Anything you're struggling with? Then I would suggest we look at some more. Yeah.
I have a question about the location of the seminar because I haven't found it. I'm in Neuenheimerfeld, and then I joined online because I wasn't able to find the location.
Okay. So you are physically in.
Sorry?
So you are physically in Heidelberg.
Yes, I'm physically in Neuenheimerfeld.
Okay. I think most of us are not. I'm in Göttingen, for example. I think even if you went to that location, there would be nobody. Or is any one of you in this seminar room currently? No. So honestly, it doesn't matter where you are. You can stay where you are right now and just join virtually.
Okay, so today there is no seminar room. It's all online.
mean, there's always the same seminar room, but I don't think it's being used anymore because we usually do this online anyways, and many of us are in different cities. So you can Skype, like you can join the meeting from home.
Not a problem at all. Not a problem at all.
Sorry for that. Yeah.
Last time it was here, but thank you.
Okay. Yeah. Okay. So back to the screening. I think, yeah, we agree that this one could be excluded. I'm looking at something that might be a bit, yeah, maybe let's look at this one. Any opinions on exclude or include? Probably exclude, yes. I agree.
It also doesn't mention the costs again. So
exactly, yeah. So yeah, I agree and would also exclude. What we can do as a kind of last exercise is look at your included studies and just see whether we include, we agree with including them. And also to get a sense of how they look different, how they are different to what we have excluded now. This one I would have actually also excluded, I think.
to be honest, I think there are a lot of them are wrong because I did it like I said before, that I rather over included stuff.
Yeah, no, it makes sense. Yeah.
I think the only one that really I'm quite sure that it should be included was actually a systematic review about the costs. But yeah, or maybe the next one. But I don't know. There are I think a lot of, to be honest, that are rather over included.
Yeah.
because I didn't find proper studies.
No, it makes sense. It also makes sense according to the inclusion criteria that you had defined. If you were still looking at the prevalence of child maltreatment, then of course many more of those that we are looking at should be included. But yeah, that's why I think it's super useful to do this exercise together and get more of a sense of that you can be quite strict with excluding. I think looking at the next one, that actually just from the title looks relevant. Yeah. This study estimates the lifetime costs to society of incidental abusive head trauma events. So this this does look relevant. Does everybody agree? Okay, a lot of yeses. Perfect. Yeah, so that's great. I think in general, what we can also do is that whenever you could, for example, use your maybe list, and whenever you are unsure about whether something should be excluded or included, you can always pick the other's brain and ask them about their opinion. Like, this is something that can be done easily in an interactive way, and it's also often in review teams or in systematic reviews that I have conducted. We often had Skype calls where we went title by title for all maybe ratings, for example, and then discussed as like a review team of 4 or 5 people, discussed for each and every title whether it should be included or excluded. So yeah, I think you get faster with these ratings. The more you screen, the easier and faster it gets, and the more you get a feeling and sense of what type of studies you are looking for. So it's very normal that in the beginning it's a bit slow and a bit unclear, but it gets better. And it's also something where you can always easily ask for a second opinion. But generally with practice, it gets really quick after a certain while. Are there any other questions or concerns about the screening stage so far?
I have one more question that appeared, I think, also in the group. I think Felix had the same problem. Did others also had the problem that it always had to reload, and then the screen kind of blocked, and then it had to reload all the articles, and then you every time start from the beginning? Or is that my computer and me?
No, I often have the same.
Okay.
Yeah, I'm sometimes not very pleased. Sometimes the website is even down a few hours. I also had this. Okay. They are based somewhere in Qatar, and they have like a helpline or something, so you can also email them and report problems. But yeah, it's not bug free. There are sometimes it's slow, sometimes it's weird how it does certain things. But I never had like a lot of I never experienced anything where my work got lost or something, or not saved. So as long as you are online and you are doing it, everything you do should be saved. And you can always pick it up at the stage where you have left it. And it's compared to other screening softwares, it's not worse than others, and it's for free. So yeah, there's nothing that is much better actually.
And just wanted to make sure that it's not my computer
no,
only.
no, it's not you doing something wrong. It's definitely Raya.
Yeah, today it was like really bad with me because I just could do 10 studies and then it crashed again like all the time. And then of course you take like 10 times the time you need to
Of course,
do 100 studies. But okay, well then if it's like the same for everyone, then I guess we can't do anything about it.
Yeah, sometimes it's really I think it depends on how many people are using it simultaneously or something. So it maybe just implies that many people are screening studies right now. So this has happened to me before, and then I would just wait for like a couple of hours and do it, and then it would be fine. And it never works on trains or something if Wi-Fi is not strong enough.
That's right. I tried it today and it had to reload every second minute or something.
Yeah.
So I didn't do so much today in it.
Okay, yeah. So yeah, this has nothing to do with you and is annoying. But it's not always like this. So yeah. Okay, then one last, if there are no more questions about Ryan, I have one last point. I deinstalled my WhatsApp and now I couldn't reinstall it with my old number because I lost the SIM card. So now I have a new number and I can't join the economic burden group again because I'm the admin and my old number would have to add me and it doesn't exist anymore. So you can, in a sense, you can still use that group, but I'm not in it. But on the other hand, I also don't know whether it's important that I'm in it. If you can all reach me kind of individually and by email. I don't know, do you think I should create a new group for all of us with me in the group, or can you just continue using the old one and whenever there's an issue you get in touch with me directly?
Usually in that case, the first person you've added to the group is a new admin. So you can ask one of the people who are already in the group. I want to join that group too as well. I didn't know about it. But you can ask someone who is in the group to look for who is the admin, and they can add you and then make you admin again, maybe. Yeah.
That unfortunately just works when she lost her, like when she dropped out of when she would have left the group, then it would work like that.
Yeah, she hasn't left the group. Yes,
she hasn't left the group, and therefore she, like, nobody else got admin, and therefore nobody can invite you guys.
Well, for the new group, make a few of them as admins.
Yeah, I'm sorry for that completeness. Yeah, so what is everybody fine with keeping the old group and you get in touch with me in person and I can send you I can give you my new number now, or do you want me to create a new group?
I would think just make a new group because then it's more easy, and I think otherwise you will be confronted with a lot of similar questions, and I think it will also help if everyone can read.
Okay, that makes sense. If it doesn't bother all of you to have too many WhatsApp groups, then I will just create a new one right after our call, and we can use that instead of the old one.
Okay, how can I join the group, the new group?
Can you send your number in this chat, and then
yes.
Can you see how to use the chat?
What's your name in the chat again? Sorry.
I think I show up as. Do I show up with a name?
I will send it to everyone. Yeah.
Yeah, just send it to everyone.
Yeah. Okay. The WhatsApp number. Thank you.
And then I will create a new group. Yeah. Really sorry for that. Cool. Okay. I think that was everything that I wanted to cover for today. But are there any questions that you would like to discuss now? Otherwise, you can always email me. And yeah, in general, I suggest for all kind of major steps, like submitting the Prospero protocol, you should be CCing Professor Brandinghausen. And and just see whether he responds. Like, don't wait for a response, but use it in order to inform him and give him the opportunity to join the conversation. But I wouldn't wait with like submitting something for him to reply, but I would obviously see him and just put like, if please let me know if you disagree or if you want me to hold this off for another week or something. Does that make sense? Cool. Okay, then yeah, I will create a new WhatsApp group right after the call, and if there are more specific questions you have with regards to your protocols or screening decisions, you can email me or use the group, the new group. And then in the next seminar, we will discuss different quality rating approaches, which you can then use to complete your Prospero protocols. And then, yeah, we will talk about meta-analysis more towards, and I think actually next year. Okay, in that case, I think we can finish here. Thanks to all of you, and I hope that one of the next seminars, Professor Bernikhausen can join us again. And yeah, I will create a new WhatsApp group, and sorry for the hassle. Cool.
One more question. Is it sensible if we write our names, not our names, maybe name and phone number into the chat here, because otherwise, or do you have all the numbers? Does it make it easier for you?
That's actually, I have some numbers, but it's confusing. So if you could do that, it's even better. Yeah, if you can, that's a nice suggestion. So all of you can quickly type the names and phone numbers, and then I will make a new group. Perfect. Okay, that's a lot of numbers. I'm really laughing. And then you will have my new one when I create a new group. Cool. Okay.
Janina?
Yeah.
Since the course is held in English and we all discuss everything here in English, can we also make the chat in the group in English?
Yeah.
Because I speak very limited Deutsch. I'm still learning.
Yeah, you're right.
Hard to follow.
Some discussions in German, but yeah, we can do that. Makes sense, yeah. Okay, cool. Then thanks to everyone and have a good evening. And then we will touch base, I think, in 2 weeks again. Cool. Have a good evening. Bye-bye.